Okay, welcome to another webinar for the equine series. This one deviates a little bit from our pasture management, and this is a equine first aid management series, and it really details on what a person or a horse owner should do between the time they call the vet and the time the vet actually arrives. So we are privileged to have Dr. Christine Cocquyt join us from Tennessee Equine Hospital to present us with a few things that we can do in between that time that could be really valuable to the horse as well as to the vet that will be treating you. So welcome, Dr. Christine, and we look forward to hearing your presentation.
Thanks, Matt, and good job on pronouncing my last name. Yeah, I wanted to go over some of the more common emergencies and some things that you can do until we're able to attend to your horse. So maybe. Okay. We'll go through some of these various scenarios, but as you can see, emergencies can be somewhat varied. So moving on, the objectives that I wanted to cover in this presentation were, it's hard to know abnormal until you know normal. So we're going to go through some of the normal physical examination findings that you can do on your own at home to help assess the situation and help give your veterinarian some more information about what might be going on. And that's going to help everyone involved in the situation. We'll go over some things that you can keep in your first aid kit to help you respond to different things appropriately. And then I'll go through some of the more common emergencies and how you can respond to those. There's far too many things to go into much detail, but we'll cover some of the basics. So at the very forefront of your physical examination, you just want to take a step back and examine the horse before you even start laying hands on it. The normal horse we consider to be bright, alert, and responsive. Sometimes we'll abbreviate that as BAR. Is he reacting to you in a normal way, head up, ears forward, eyes alert? Some questions that you want to ask as you're looking at your horse, does your horse appear comfortable, or is he really restless, maybe up and down, showing some signs of pain or distress? Is the horse eating and drinking normally? Is it bearing weight on all of its legs while it's moving around? And does its movement look fairly normal for that particular horse? And then also kind of assess the surroundings and see if it appears to have a normal amount of manure and fairly regular consistency for that horse. Those are all questions that will help sort of answer some questions that the veterinarian might have. The main things for physical examination include taking its temperature. And in horses, really our only option is to do a rectal temperature reading. The fast reading digital thermometers that you can pick up in any supermarket or convenience store is just fine. You just can insert it pretty easily into their rectum all the way to the little window where it gives you the reading, and leave it there until it beeps. The normal temperature in an adult horse is going to be between 99 and 101 degrees Fahrenheit. And anytime your horse just seems a little not right or kind of out of sorts, it's a good idea to check the temperature. Sometimes you'll be surprised and you'll find that the horse actually does have a fever. It's also a good starting point before you give any medications, because anti-inflammatory medications like bute, Banamine, or Equiox will all lower the temperature of the horse. So that can kind of skew some of the findings for the veterinarian and the full assessment of the horse's condition later on. In case you're not familiar, all of those medications that I listed are sort of similar to Advil in people. The next step would be to take a heart rate or a pulse. The normal heart rate in a horse is going to be 28 to 40 beats per minute, and that should be very regular sounding, so at regular intervals. Horses' heartbeats are considerably slower than humans, so you may have to sort of pause and listen or feel for several seconds before you start to pick up on it. If you have a stethoscope, you can listen just behind the left elbow, and you should be able to hear the heart in that general area. If you don't have a stethoscope, you can still get a pulse rate. There's a little artery on the inside of the mandible. You can see it in that nice pixelated picture that blew up badly there. But if you put your fingers just inside the mandible, you can kind of roll around. There's a cord-like structure, and that's actually the artery. You just apply light pressure to that, and you can typically pick up a pulse there. You may be more familiar with feeling the digital pulse, and you can feel that as it runs over the sesamoid bones on the back of the ankle of the horse. Same concept there. You just want to put light pressure so that you can sort of feel it, but not enough pressure to occlude the vessel, because then you won't get an accurate pulse. As far as respirations go, the normal respiratory rate in a horse is going to be 12 to 20 breaths per minute. And again, nice and even and regular. Some common abnormalities with respirations that you may see include nostril flaring. So the horse is really expanding its nostrils to try to get air in. Often we'll see horses with an increased abdominal push on expiration. And that may be, it's a little hard to explain, but if you ever do see it, like in a heavy horse or a horse with a condition similar to asthma in people, that would make more sense. Horses with respiratory problems may make loud noises while they're breathing. They may extend their head and neck to try to get more air in. And horses with respiratory problems may also have nasal discharge. So all of those things are good to note and be able to tell your vet when you call. Mucous membranes are another thing to check out. They can give you an indication of if the blood perfusion is normal to the tissues and if the horse is fairly well hydrated. So this picture in the middle is fairly normal for a horse. It's kind of light pink and it should be fairly moist when you look at it. This person, it has his thumb there to kind of compress and do what we call a capillary refill time. So you push into the mucous membranes and let your thumb go, and that should pink up. It'll blanch out, but it should pink up again in just 1 or 2 seconds. This horse over here is extremely sick. The blood flow is very abnormal to the peripheral tissues, and that's why this horse's mucous membranes are so bright red. So that horse is in fairly serious condition here. The horse over here is a little bit yellow and kind of pale, and this horse actually had red maple toxicity, so it had eaten red maple leaves, and that caused its red blood cells to break up, and so it was very anemic and pale. So moving on to what you might have in your first aid kit. Clearly from our conversation just a minute ago, a thermometer is key. So everyone should have a first aid kit in their tack box or in the barn somewhere. A stethoscope is handy. There are some fairly inexpensive ones that you can get that will work just fine for getting a heart rate, and also sometimes listening to GI sounds, which you can do in the flank area on both sides. Bandage material is also handy to have nearby. So a disposable cotton roll or a reusable standing leg quilt works very well. Sterile non-stick Telfa pads are good to have on hand. And then vet wrap and or a polo wrap work just fine for keeping bandages on. Duct tape often comes in handy as well, especially for foot bandages. Gloves are good to avoid contaminating wounds any more than there already are. Some sort of gentle cleaning solution, so a betadine or chlorhexidine scrub is okay. You don't want to have anything too caustic around. Epsom salts can come in handy if you have a foot abscess. And then again, Banamine, which is an anti-inflammatory. The actual drug name is called flunixin. Banamine, having a dose or two of Banamine is often handy. Just use it on your veterinarian's advice, of course. And Banamine comes in a paste form, so it's very easy to use. So what is an emergency? I would say the main emergencies that we see include colics, chokes, eye problems, and wounds. And obviously there is a broad spectrum of wound issues. Wounds and lamenesses can sometimes kind of go together. So we also see non-weight-bearing lameness. We'll see foreign bodies, respiratory problems, neurological problems. Down horses are fairly common, especially in the wintertime. Dystocias, which I'll go over a little bit more, and then a herd or a barn illness. So if you have multiple horses in the same barn that are sick, that would constitute an emergency. So some key things to remember in an emergency, and they're not always that easy when you're in that situation, especially when it's your own horse. But if you can, just try to stay as calm as possible and just take that step back to sort of assess the situation. And that's going to help you with the second point, which is safety. Emergency situations can involve horses that are in distress, and that can become a dangerous situation for you and any other people around other horses and the horse in question. So anything you can do to optimize the safety of the situation is really, really important. The TPR, the physical examination that we just went through, is a good starting point. And again, it can provide some really useful information for your vet. And then call the veterinarian and get advice from them. Once you can provide that information and sort of accurately assess the situation to the best of the ability at that time, that is all going to help your vet help you. And of course, we always try to get there as soon as we can. But as Matt had mentioned, sometimes we do get a little bit delayed with other emergencies. So we're always trying to help you as much as possible. So I just wanted to go through some of those more common emergency situations, sort of very basically explain them, and then some of the things that you can do or some of the things that you can expect with them. So colic is probably the number one emergency that we attend to. And colic itself is just really a catch-all term for any type of abdominal pain. So as you can see from this little chart, we often break colics down into medical conditions and surgical conditions when we assess them. And that is often based on the level of pain, our physical exam findings, and the specific things that we do to evaluate colics, as well as their response to medication. Sometimes a colic will respond to a little bit of hand walking and a dose of Banamine, and sometimes it's hard for us to keep a horse up on its feet long enough to even get it into surgery. So if your horse does appear to have a surgical colic, that ends up being a referral situation if surgery is an option. Medical colics can sometimes, as I said, be treated on the farm, and sometimes medical colics can also become fairly intensive cases that need further treatment at the hospital. Some signs of colic are actually fairly broad. It can range from just a lack of interest in eating and maybe a little bit less manure than normal, to no manure for an extended period of time. Sometimes horses will be pawing or pacing. They may get up and down a lot, or just be lying down more than normal. Sometimes lying down fairly normally, but just more than usual. Oftentimes they look fairly uncomfortable when they're lying down. The classic colic sign that people think of is the horse rolling around in its stall, and that can certainly happen, especially with some of the more severe colic types of colic. But that is not the only indication that a horse is having abdominal pain. Some of these horses will be so uncomfortable that they'll shake or sweat quite a bit. And then some of them will also act just sort of dull or depressed. So any of these signs could indicate that your horse has a colic issue. So if you can safely check the temperature and heart rate of your horse, if he's not flopping around in the stall and you can go in and safely do that, those things can be helpful in assessing the whole situation. You should always take the feed away from the horse if you suspect that they are having some colic issues. Call your veterinarian when you first start to suspect that there's a problem. Sometimes we'll just, start with having an owner give a dose of Banamine and see how the horse responds to that, depending on the description of the condition and this sort of situation that's going on. So we may just have you do that, or we may come out and take a look at the horse right away. One note on Banamine, it does come in a paste form. It also comes in an injectable form. Just an old horseman trade is to give the Banamine in the muscle. It actually can make horses very sick. It doesn't happen very often, but every once in a while, Banamine in the muscle will cause a really, really bad infection. And I've seen horses with muscle rotting away from it, or even horses pass away from the consequences of that infection. So it's really important, in my opinion, to not give Banamine in the muscle. You can give the injectable by mouth, and you can also use the paste. If you're really proficient with IV injections, that the injectable can be given that way too. But in an emergency situation is probably not the time to learn how to give IV medications, because that can cause other problems as well. So when in doubt, just give Banamine by mouth. If your horse just wants to lie there quietly, that is completely fine. If they're rolling or they're restless, walking for a few minutes to see if that improves the situation can be helpful. And walking intermittently a few minutes at a time is fine. I've definitely showed up to colics before where horses have been walked for like hours, and the horses are just so exhausted and the owners are exhausted, and it probably didn't really help the horse that much in the long run. It probably just made them a little bit more dehydrated. So call your veterinarian early on, and some walking is good, but hours of walking is probably not necessary. Choke is another fairly common condition in the horse. When we talk about choke in the horse, it's not actually an obstruction in the trachea, so they can breathe. They should have airflow through their nostrils. It's actually usually when they take a really big, fast bite of food and they swallow it in a big clump and it just gets lodged in their esophagus. And horses have a really long esophagus and they're not able to regurgitate like other animals can. So it just gets stuck there. And horses sometimes aren't the brightest, so they'll often keep eating, even though they have an obstruction in their esophagus. And that just makes more feed pile up in that area. So usually we'll start to see signs while the horse is eating or shortly after it finishes eating. The signs can vary from just a cough or two to really, acute distress where the horse is like throwing itself down and just acting like it's just lost its mind. Usually that only lasts for a minute or two. But then the horse will often kind of stretch its head and neck out in weird directions and maybe stick its tongue out. And again, the coughing. And the classic sign for choke is seeing feed come out of the nostrils. Since nothing can pass through the esophagus, especially in those horses that kind of keep eating, the feed and the saliva will continue to go down into the esophagus and get backed up to the point where it does come out of their nostrils. So if this happens and you realize that's what's going on, immediately remove any food or water from their stall so that they can't make the condition any worse. You can try massaging their neck. The esophagus of the horse 99.9% of the time runs along the left side of the neck. So you can kind of focus on the left side of the neck and sort of massage out any lumps that you might find. Every once in a while that does help. It doesn't always relieve a choke, but it'll give you something to do and keep your horse quiet. If the horse is not super distressed, not laying down and rolling and all of that, you can walk the horse a little bit, and sometimes that will help kind of relax them and get the mind off the choke, and sometimes that is enough to help move the obstruction down into the stomach. The other thing you can do is just try to keep the horse quiet. Just keep it up in a stall and let it put its head down as much as possible, and it's okay if the food is running out of its nose as long as it's quiet and not really distressed. I didn't really want to go over a lot of medication recommendations in this webinar. I think that contacting your veterinarian and discussing what medications you might have on hand and what might be useful in this situation is probably the best, so that every situation can be dealt with individually. So really there's not a whole lot you can do for choke, unfortunately, but just some of those little things just kind of keep the horse as calm as possible, and massage it can often help. Chokes can often resolve themselves on their own. So you may find that you call the veterinarian immediately, and by the time they get there, even if it's 20 minutes later, the horse is fine. And that's not a problem. We never mind that. But they don't always resolve themselves. So it's always good to call. Eye problems are a big issue in horses. And before we kind of went through some of the signs of eye problems, I wanted to get everyone on the same page for as far as eye anatomy goes. Horses' eyes are very similar to people's eyes. So this may be familiar ground for you, but some of the things that we will talk about when we're talking about eyes in general is the pupil. And so that's this blacker area here, and the pupil will expand and contract just like ours does. And often, we may ask you, the size of the pupil compared to the so-called normal eye, because if it's small or larger, that can give us some indication of what's going on. The general surface of the eye, like all of this, is the cornea. And we talk about the cornea quite a bit in horses. We'll go into that in a second. The horses do have a fairly prominent third eyelid that lives in the inside corner of their eye, and they can actually move this almost all the way across their eye. And it's, to flush stuff off of the surface of their eye as needed. So there can be some conditions involving the third eyelid, but usually they're not emergency situations. Horses have a nice smooth border to their eyelids, and that comes into play when we are talking about eyelid lacerations. So that's good to note. And then these little things are sort of unique to horses. They're called corpora nigrans, or little black bodies. And you may see them inside the pupil. They kind of sit on the inside part of the eye. And they can be quite large, but they don't really obstruct their vision or anything. They're a normal part of the horse, so don't be alarmed if you see that. If you do see any of these signs, however, that can indicate that there's a problem with the eye, and eyes are almost always an emergency in the horse. So if you go out to the barn and you find that your horse is squinting a lot, or there's any redness associated with the conjunctiva, which is sort of the lining of the eyelids and sort of along the edge of the eye. If there's any swelling around the eye, discharge that the horse does not normally have, usually coming out of the inside corner of the eye. Any cloudiness on the surface of the eye is an issue. If the pupil looks really small, especially compared to the other eye, that indicates that there's some pain and inflammation in the eye, and that should probably be addressed. And then eyelid lacerations are usually an emergency situation. So just to forewarn you, and you may have picked up on this, some of these pictures will be fairly graphic. So if that bothers you, I apologize right now. I tried to minimize any gore. This horse obviously had some issues associated with the eye. This is the post picture. So it had a little trailer incident, and it had some fractures and a pretty large laceration around its eye. So this one's fairly obvious. It is not always that obvious. These are some fairly common situations with horses' eyes. Corneal ulcers or scratches on the surface of the eye are very, very common. Horses have big eyes. They're exposed to a lot of debris on a regular basis. They eat hay out of a hay feeder, so they can get poked and scratched in a variety of different ways. It's the whole put the horse in the padded room thing. You know, they'll hurt themselves somehow. The main thing with scratches on the surface of horses' eyes is that they easily can get fungal infections. And this horse right here had probably a fairly simple scratch on his eye, and this got a fungal infection. And this is actually, this tissue that you can see are actually layers of the cornea just sloughing off. So fungal infections can be extremely severe, and the eye is at risk of having to be removed once they start getting a fungal infection. So that's one reason why eye problems are almost always an emergency, so that we can get the horse on proper medication to prevent that from happening. Uveitis is a very common cause of pain in the eye. Uveitis is just inflammation in the front part of the eye. And so it may cause some swelling and squinting and tearing in the horse. Those are the most common signs of uveitis. If you see these and you suspect that your horse has uveitis, it's still a good idea to have your veterinarian come out. And what they can do is they can apply a stain to the surface of the eye and make sure that there aren't any scratches, because the medications that we treat for uveitis are contraindicated for treating a scratch on the eye. These medications often have steroids in them, and steroids can lead to a fungal infection. Along those lines, and it's important to not just put any eye medication on an eye that looks abnormal, unless you've discussed it, beforehand with your vet. A lot of eye ointments have steroids in them, and that, as I said, can lead to infections if there are any scratches. Another problem that horses often have are called stromal abscesses, and this horse has a stromal abscess. So he doesn't actually have a scratch, but he has a little infection inside the layers of the cornea. And that can be very painful and can also get extremely infected. So that's another, any abnormal markings on the surface of the eye should be, or within the eye, should be looked at. We already kind of covered trauma with that last case, I think. Horses can get little foreign bodies in their eye, little pieces of hay, or pulled out like seeds and thorns and all sorts of stuff. So that's another reason why we need to look at them immediately. And then eyelid lacerations are probably even more important than a lot of lacerations on any other part of the body. And the reason is that we want to get those eyelid margins back in alignment as perfectly as we can. And the longer a laceration has been there, the harder it is to get it to heal properly. So the sooner we can get to those, the better off we are. So as far as treating eye problems, before your veterinarian gets there, there's probably not a whole lot you need to do. Often in these cases, we will have you give some anti-inflammatory if you have them, usually a dose of Banamine. Wounds are an extremely broad topic, so we'll try to cover a few pointers here. Some key questions to ask yourself when you're evaluating a wound. You want to identify if it's near a joint structure. This radiograph is an image of the hock. So that's the big joint on the hind leg. And there was a wound right here that kind of led to one of the bones in the hock. And there's actually some infection right at that point. So some trauma and infection. So it's important to know if it's over a joint that can significantly affect the prognosis of the wound, of the healing. Kind of try to evaluate how deep the wound might be. Is there uncontrollable bleeding? It is possible to have cuts and lacerations cut into arteries and veins, and that can require some additional, hemorrhage control and wrapping. And is the horse bearing weight? Is he fairly comfortable on all of his limbs, or is the hurt leg, really super painful? Another question is the wound over the chest or abdomen, because that can involve some vital internal structures. That's less common than leg wounds and stuff, but I've certainly seen a number of horses with goring injuries from cattle or falling on a post. Okay. So probably the first thing is to stop any bleeding that seems to be excessive. You can do this with a snug wrap. You can just apply digital pressure. You can put a tourniquet on to some degree, but you don't want to leave it on too long. You want to make sure that you're not putting too much pressure on any tendinous structures. Again, try to stop the bleeding, maybe with some pressure over the wound, and then let your veterinarian walk you through exactly how to apply any sort of more lasting tourniquet. More superficial wounds that aren't bleeding a lot, you can probably wash out with some water. It's best not to, start scrubbing away at wounds with lots of different products. Don't use peroxide or straight iodine. It can be really hard on the tissues and make them a lot less healthy, which then leads to poorer healing. And along those lines, don't start applying just random ointments and sprays and powders. I've had wounds that happened, shortly before I got there, and by the time I got there, people have put caustic powders on the wound, and the tissue just shriveled up, and I couldn't even suture it up anymore. So avoid the urge to put stuff on wounds. It'll be okay for a little while. If you need to do something, just apply a clean, dry bandage, and we'll go through the kind of steps of a bandage in the next slide. And if you don't have any bandage material, then at least try to keep the horse in a clean, dry area. So out of the mud, away from a lot of manure contamination, things like that. Probably a good idea to minimize movement until the wound has been fully assessed. And then another pointer is to just try to check on the status of your horse's tetanus vaccination. Horses are really susceptible to tetanus, so they need to have a booster vaccination if they haven't had one within 6 months of an injury or a foot abscess. So that's something you can kind of look into while you're waiting for the veterinarian to get there, because you'll probably be asked. Okay, so the 3 C's of bandaging, they're contact, cushion, and compression. So as far as contact goes, over a wound, just put a non-stick pad over it. If you don't have, a medical bandage pad, you can use a diaper or a maxi pad as well. Just something to sort of cover that wound in a fairly sterile or clean method. The cushion layer is something that a lot of people don't think about when they're putting bandages on. You know, everybody wants to put a piece of paper towel and some vet wrap over a wound, and the vet wrap, if applied inappropriately without cushioning underneath it, can actually cause some damage to other structures of the horse. It can easily get too tight. So the cushion layer is really important. It's going to prevent you from putting a bandage on too tightly or unevenly. It just kind of gives you a little bit more leeway when you get to your compression layer. This picture shows just some standing quilts, and those are really handy to have on available to you in the barn. You know, a clean quilt is just fine for your cushion layer. If you want to go out and buy different cotton rolls and banded specific medical bandage material, that's fine too, but just a clean leg wrap is fine. The compression layer is probably most commonly vet wrap. You're probably familiar with that self-sticking, kind of stretchy wrap that comes in a roll. When you're putting the vet wrap on, I like to say put it on until the crinkles start to straighten out. Anything beyond that could be too tight, and anything less than that is probably too loose. So that's a good guide for the vet wrap because it has the crinkles. Elasticon is a really, really sticky bandage tape. It's usually more of a cloth-like consistency. And Elasticon is meant to just stick to the skin really well. So you don't have to stretch that out tightly before you put it on. It's really stretchy, and if you do that, it'll become too tight. So you just kind of unroll it and lay it against the tissue, and that will stick to the leg and help keep your bandage in place. Polar wraps will work just as well for a temporary bandage. So again, not too tight, and put even pressure wherever you're bandaging. That's especially important when you're bandaging in the area of this photograph, so along the flexor tendons. You specifically want to avoid putting uneven pressure. I spoke about chest and abdominal wounds. This was just sort of an interesting case, so I thought I'd share it with you. This horse had an axillary or chest wound here, and it actually penetrated in enough that it let air in under its skin all over its body, and then also into its chest cavity. And then it sort of sealed over, so all of that air was trapped in there. So he was like this giant marshmallow man horse, and if you pressed on him, it made crinkly noises. But he did actually have some air in inside his chest cavity where his lungs are, and so we actually had to put a drain in and let some of that air out. So that is and this is not the only case I've seen with a wound in this area that's gotten all of this air underneath the skin. So that's just something to be aware of. If you ever have a wound in this area, you can just sort of put clean gauze in there, or sterile gauze, and sort of cover it up as much as you can to discourage air from tracking up in there. Lameness is sometimes an emergency. If your horse, comes out of the field and is non-weight bearing on a leg, certainly call in and let us know, and investigate the situation a little bit. If your horse is eating and acting pretty normal, it probably doesn't have a life-threatening injury to its leg, but certainly maybe something that needs to be addressed shortly. Identify any swelling anywhere on the leg. Is there a wound somewhere that's causing him to be lame? And another thing to note is check the temperature and see if the horse has a fever. Often sometimes horses that are severely lame will have an infection under the skin on one of their legs called cellulitis, and they'll usually have a fever with that and be quite uncomfortable. A lot of the time when we have these acute non-weight-bearing lamenesses, they end up being foot abscesses, to be perfectly honest, not always, but quite often. This is an x-ray from the side of the foot, and there's actually a little gas pocket right here under the toe, and that's a fairly typical, what we call subsolar abscess. So sometimes in these situations, we can dig in and make a little draining tract from the bottom of the foot. And then in some cases, this infection pocket will actually track upwards and break out the coronary band. So the coronary band is another area to look at when your horse is not walking well on that leg, because there may be a soft spot there where an abscess is trying to break out. And that's what's going on here in this lower picture over here. That's a coronary band where an abscess has already sort of started breaking out, and it's pretty soft and inflamed looking there. So this picture over here is actually probably a representation of cellulitis. So you can see how much thicker this leg is. You've lost a lot of the tendon definition like you have on this leg. You can't really see that over here. So this is moving into what we would call tree trunk phase of the swelling. And this leg likely has some subcutaneous infection in it. So we would treat that with antibiotics and anti-inflammatories. This horse more presents like an abscess might. One thing I didn't put in this presentation, but that is a fairly common emergency in this area, is laminitis or founder. And I don't know if you can tell, but this horse is sort of putting more of its weight on its hind end, so it's sort of rocked back. A horse with laminitis classically will put both of its front feet kind of out in front of it, like this horse has this one leg, and sort of rock back. So if your horse is doing that, and having a lot of trouble turning in both directions and not wanting to move at all, those may be some indications of laminitis or founder. And that should be, you should call your veterinarian at that point. So with lamenesses, it's good to wait to give anti-inflammatories like bute or Banamine until your veterinarian tells you to. Those medications can really mask some of the lameness issues, and so it can sort of impede our assessment of the horse, when we do get there to look at him. In many situations, you can cold hose or ice a leg if it's swollen. And in some situations, you can apply a standing wrap, just with that quilt and a polo or something, if a little support is warranted. So every situation is a little bit different. So it's hard for me to really say, this is what you need to do in every situation. So unfortunately, I know that was probably what people were wanting out of this webinar, but a lot of scenarios kind of need to be dealt with on an individual basis between you and your veterinarian. But the more you can do to assess the situation accurately, the better off, the better recommendations we can give you while you're waiting for us. Foot injuries are somewhat unique. There are, horses can step on things very easily, and there are a lot of important structures within the hoof itself. So if your horse ever does step on a nail or anything like that, don't pull it out if that's at all possible. We can actually take an x-ray and see where that nail might be going. Now this horse did not step on this. It had a large wound that tracked up this way. And so we put a radio opaque probe in the tract and we could see where it went. But sometimes if they have a nail, we can see if it goes up this way or if it's way over here, or where it might be, what structures it might be involving. This wound went into, so this is your coffin bone here, this is your navicular bone, and then your pastern bone here. So that wound on the left there actually went right into the joint structure around the navicular bone, and then it also went into another synovial structure called the tendon sheath that kind of goes up here. it is filled with joint fluid. So that horse had a fairly poor prognosis because of where that wound went. And it's important for us to know what structures might be involved in order to treat the horse appropriately. Sometimes we'll get calls about respiratory distress or increased respiratory rate. Horses are prone to getting what we call heaves, and a lot of times it's associated with kind of allergies. And so, just like people in Tennessee, horses in Tennessee have a lot of allergies. So you may see an increased effort and rate to the respiration. Many of these horses will have a nostril flare. It's good to check for any obvious swelling of the nostrils, because that can be a more critical condition. It's also important to check for airflow from both nostrils to help determine if there's actual obstruction or if the horse is just having trouble, moving the air through its respiratory tract. If a horse has heaves, which is very similar to human asthma, there are some medications that can help to alleviate some of those signs. But the main thing would be, until the veterinarian gets there, just keep your horse cool, put a fan on him, try to get good ventilation to the horse, and just try to keep them calm. Most of the time, they'll just look a little bit anxious when they're breathing and not be in full-blown distress. If the horse does not seem to be having to be moving air through its nostrils, then that is a fairly significant emergency, and we'll be there with sirens blaring. We also encounter neurologic issues fairly commonly. So neurologic signs are fairly broad, but some key ones that you may take note of: if your horse starts walking like he's a drunken sailor, then he's probably neurologic. Some of these horses will circle just sort of aimlessly or wander aimlessly around as well. Sometimes they'll be so unsteady that they're actually falling down to the point where they may not be able to get back up. And sometimes you'll see a head tilt or some other signs associated with their head. There are a lot of different causes depending on what signs you're seeing. So just sort of evaluate any sort of abnormalities in your horse so that you can pass those signs along, and it'll help us narrow down what may be going on. If the horse is safe enough to move, put the horse in a small level area, a round pen or a small arena with good footing would be a good area to put them in, or even a large stall, especially if the horse is not kind of to the point where he's falling down. Try to keep everyone as safe as possible in this situation. In particular, an unsteady horse can easily be a very dangerous horse. And even if your horse doesn't mean to hurt you, if he can't control where his legs are going, doesn't even know where his legs are going, he's not going to be able to prevent hurting you if you're in a bad spot. So try to minimize contact with the horse, try to minimize the number of people in contact with the horse, and don't move them any more than necessary. And that's really probably all you can do in these situations until your veterinarian gets there to assess the situation. So just remove anything that might be a hazard to the horse, and keep contact with them to a minimum. We often get calls about fever. So owners that have been through the drill and have a thermometer on hand and have already checked the temperature. Usually a temperature over 101.5 degrees Fahrenheit indicates that there's probably something going on. These horses are often commonly off the feed as well, so they may present with some colic-like signs. Numerous causes for fever, so it's a fairly nonspecific sign. But check for any nasal discharge of any type, any swelling under the jaw or in the throat latch area, and any diarrhea. And that may help pinpoint, at least a general body system that we might be dealing with. Depending on what the temperature is and how quickly we can get out there, again, if you have a dose of Banamine, we may advise you to give that. You can always hose the horse with cool water or pour some rubbing alcohol on them. Just be sure to scrape any of that off, because the idea is for the evaporation to cool them down. And then put a fan on them as well. Some things to think about, while you're waiting for the veterinarian, or has the horse traveled at all recently? Has it been exposed to new horses? Has there been any change in management? And when was your horse last vaccinated? All right, we're almost done, so just bear with me for a few more minutes here. The down horse can be a pretty significant situation, and one that we do encounter on a regular basis. Don't worry, this horse doesn't look very good, but she recovered fully. She actually had botulism, so she couldn't use her muscles, basically. So we had to hoist her for about a month up and down, and she did make a full recovery. So, safety is very important with the down horse. Sometimes these horses are kind of stressed out and thrashing around. So if that's the case, then just stay out of the way. There's probably not a lot you can do. Kind of look at your environment while you're waiting for the veterinarian. If it's really muddy, try to gather some shavings or straw or something that might help with traction in that area. Is the horse on a hill? Are its legs pointing uphill? Sometimes spinning it around so that they're pointing downhill will help that horse get up. If it's hot out, try to apply some shade to the area, put a fan on the horse if possible, even wet it, or put some ice on the horse. If it's cold out, of course, cover it with a blanket and put some straw around it. That can really help. These horses can get hypothermic pretty easily, and that can make it much harder for them to get up. If the horse is pretty alert, you can offer it some water and a little bit of food. That's usually fine. Kind of evaluate for any signs of trauma, or if it looks like the horse was colicking. There are a lot of situations that can cause a horse to get down. Commonly, what we see are older horses that have significant arthritis and maybe got down in a bad spot and weren't able to get up. And then they try to get up several times, and then they get exhausted and can't get up. So in many of these situations, we'll have you give some bute or Banamine to the horse. But again, get the dose from your veterinarian and don't give it until you've talked to them. And another thing to think about, start thinking about people that can help get the horse up. Personally, I'm not a very large person, and so getting to these situations with myself and one owner who also might not be a super large person can require some creative thinking to get some of these horses up. So having some strong people on hand is often helpful. Pretty much any abnormal behavior in a really young foal is an emergency. Foals can get really sick really quickly. The foal in the upper picture is on oxygen and IV fluids and feeding tube and the whole 9 yards. So situations can go downhill very quickly, even when they don't seem like much. So any decreased nursing, colic signs, which might include being restless, rolling up on their back, or straining to poop, any lameness issues. This foal down here had an infected hock joint, and so it was really lame. Fever in foals, temperature over 102 is usually an indication of an issue. And then anything coming out of its nose, be it milk after it's drunk, or snot, basically. Dystocia, we'll just cover this really briefly. We do have quite a few problems with dystocia every year, and dystocia, for anyone who's not familiar with it, is just a difficult birthing, so difficult foaling in the mares. Some things you can do to monitor these situations is start the timer when the mare's water breaks, if you're fortunate enough to be there, and when you start to see the foal. The foals need to be out pretty quickly. So they need to be out within about 20 minutes of that foal starting to protrude. So you need to call if there's no progress fairly soon, say within the first 10 minutes. The other situation to call in is if you don't see two legs sticking out with the feet pointing downward, that can be an indication that the foal is not in the proper position. And often those will lead to a difficult foaling. So that usually needs veterinary assistance. And just a side note with mares, in case anyone has any breeding mares, the placenta should be out within about 3 hours. And if it's not, that's also a reason to call the vet. This is just one of my favorite little foals. We had to do a C-section on our mom, and it's sort of, in a little bit more rustic hospital setting than we have here, but it's on oxygen, it's got the heater on it, and we were going the whole 9 yards with that little guy. So just pointers to try to make the best of your emergency situation and visit. Stay as calm as possible. I totally understand that's not as easy as it is to say. Stay as safe as possible. That's really probably the most important thing. Contact your veterinarian early on, even if it's just to get advice. It's always better to have involvement early on rather than several hours into a situation. If you can have the horse caught and have a halter and lead rope handy, if not on it when we get there, that helps expedite things. And a safe let area is really helpful as well. In a lot of these situations, we'll need some clean water, so that's something that you can get while you're waiting for us. And if anybody feels like baking us cookies, that's always appreciated too, but definitely not necessary. So if anyone has any questions, I'd be happy to answer them. This little guy was on some oxygen. He got a little carried away with his oxygen tubing. So thanks for your patience. If anybody is still with us, it went a little longer than I thought it might.